2, 3 các bạn đã online. Okay, các bạn đã trên air. Okay, so let's go ahead and start it. Actually, I think we're 15 minutes behind. Welcome to the week 7 of medical speaking class. Today I have Dr. Joe and Sarah. The other doctors not here today, but we will do quick. The week 7 of medical speaking class. Today I have Dr. Joe and Sarah. The other doctors Okay, let me keep going. All right, so who's gonna be the first victims? So today format quite different. You're going to tell us what you're going to do, okay? And our topic today is how to deliver bad news. Well, you can tell you deliver good news already. Newborn, you know, you won a lottery, you have a new girlfriend. Today, focus on bad news, okay? All right, who is the first one?
Who is the first one? Me? Who is the first one?
All right, let me repeat again the rules. You must speak really loud. Okay, this time I want you confidence that whether you talk one way that I teach my resident or student, you look at me and speak loud. Okay, when you say something loud, you actually feel more confidence. Okay, go ahead. And why don't you start with Dr. Doe first? So Dr. Doe gonna be your patient and you're going to give him a bad news, make him cry.
I'm so nervous. You say about your topic. I would like to talk to Sarah about the breaking bad news. We have done last week. I have done with Sarah about breaking bad news about leukemia with her, and now I have learned your lesson, and I would like to talk to her again to know that can I improve much more after 1 week. Okay, Winton.
Yes, at your pleasure. Go ahead.
Okay.
Okay. Hello, Sarah.
How's my child doing?
Yes, okay. Hello, I'm Dr. Hiên. Take care of your daughter. And as you know, your daughter has fatigue and gum plating and fever. And we have done a lot of tests for her, such as blood count and bone marrow aspiration. And now, would you like me to give you the information, the disease of your daughter, Sarah?
Yes, please. I really want to know.
So you want to hear the information alone or with any member of your family?
I am the only one here, so just go ahead.
Okay. Sorry that I have to bring you. It's not a very good news about your daughter's disease. And do you hear any information about leukemia, Sarah?
What's leukemia? This is the first time I heard of it. What is it?
It's one kind of children blood cancer.
What? My child have cancer?
I'm so sorry to say to you, Ladas. She has done the blood count, and there is blood. It's a one kind of immature blood cell, and it's not normal. And we have done the blood aspiration, blood bone marrow aspiration, and she has the different component of blood. So it is the evidence of leukemia, Sarah.
So is it dangerous? I don't know, like, is my child gonna die?
Unlike in adult cancer, leukemia in children have a more chance to treat. 70% of children can, after the treatment, can live and go to school, have a normal life.
Yeah, like, are you sure this is the diagnosis? Because you only take some blood and you said that my child had cancer. Is is the test correct, or is there any possible explanation for that?
I think that is so hard to accept about the disease, Sarah. But she has the evidence of the leukemia and is certified the diagnosis, such as gum bleeding, fatigue, and prolonged fever, and the result of the blood on opposite, we can diagnose her that she has leukemia.
Uh, but like, are you sure that's it? Like, I want a second opinion. I want the head of the department to meet me. Like, I don't trust you. This is the first time I met you, and then you told me that my child had cancer. So like, how can I believe you?
This is not the diagnosis of myself only. It's the diagnosis of our department, our member of department about the case of your daughter. And after that, I have to tell you this is the ideas of on the members of my department.
Okay, so what next? Like surgery?
So now I will tell you about the treatment. She have to experience maybe 6 weeks before about the chemical therapy. The purpose of this chemical therapies is to kill the cancer cell for her.
I heard like chemotherapy is very toxic to my child. Can I use other like treatment option? Is there any other treatment option apart from chemotherapy?
So you mean that's another treatment? In what?
Yeah, like I don't want my child to have to go through chemotherapy. Do you have any other option for her?
The chemotherapy is the best way for the children cancer, blood cancer treatment. Although it has a lot of side effects, but it can be restrict the improvement of the cancer cell.
Okay, so what should I expect from the chemotherapy? Like any side effects, anything like that?
Yes, it has some side effect. Your baby may be vomit or hair loss, and but I think that's the amount of the chemical. What is it? The amount of the drug we have to use to appropriate for your daughter. And I know that you find it so difficult to receive the information. So I can give you some leaflet or handover about the disease and the treatment of chemotherapy for you to have a time to read. And if you have any difficulties in the information, you can call me, and I will I will answer your question.
Okay, it's just so confusing right now. I need to go back. I need to talk to my husband before we decide anything. It's just too much.
Oh, okay. So have you got any more questions?
Not right now, because I don't understand anything to ask question.
Okay. So here's my phone number and my some handover about the disease for you to have a time to read it at home. Okay.
Okay. Okay.
All right,
Thanks.
let's stop right here and Dr. Do, you have any comments, and then I'll let Sarah comments after that. Go ahead.
Yeah, I think you're doing very good. I think the speaking is very good. It's very clear and concise. But I think at the beginning, I think you probably could ask Sarah, like instead of going straight to the leukemia diagnosis, you can just ask her, "Hey Sarah, what do you know about your daughter's condition?" And then let her tell you, like Dr. Huân said last week, let the patient tell you how much they know, so you can address any misconception and fill in any gaps. But I think you deal with them very good. I think one other thing is when the family is concerned about the side effect, you can say, yeah, there are side effects, it's expected, but there are things that we can do to help minimize those side effects, like nausea medication or like the hair loss. You can wear a wig or something for the short time. I think those would reassure them. And then lastly, just to be quick, is that if the patient does not understand, like sometimes they're very emotional and they don't hear what you say and they forget everything, maybe it's not a bad idea to discuss it again with a close family member, like a brother, sister, or even a husband in this case. But I think you did good. That's it.
Thank you. Sarah?
Yeah, like today you're a lot calmer than last week. So the information flow out like very consistent, and like I can understand what you say exactly, and you handle the emotion of the patient very well too. You reassure the patient. You do not you didn't confront the patient even when they asked like when she asked about like are you sure about your diagnosis and everything. You still very like calm and replied back to her instead of confront her. So I think it's a big improvement compared.
All right, I agree with Dr. Do and Dr. Trinh that you did a nice job. But here's my thing. I challenge you not to use a lot of medical terminology. Leukemia, it's a term that for us it's common, but for patients, they may not, or they don't understand what it is. And one of the more challenging for cancer patients is you have to explain them precisely, but use slang terms. So I encourage you guys to think about what's the better way to explain, because you say based on lab, based on this, but try to find a simple one. For example, the way that I say it, your kid have, we call red blood cell, and that's white blood cell. And if they grow uncontrolled, that's a type of blood cancer. And you wait for them. Some of them will understand and they not, and then some of them will say, hey, what is that? And then you keep going. When we deliver bad news, try to give direct but small piece of information, because the patient, they may or may not comprehend everything at once. Okay, so let's move on to the next one, because I think next one is, how many people we have today? Let's give a head count.
Nine.
Okay. So Dr. Do, you remember the Kaplan-Meier survival curve, right? So this class started with, I think, 14 or 15. So after 7, only 9 survive. So this is quite comparable to a type of cancer. I don't know which one you would like to say, but at least in my opinion, the Kaplan-Meier curve for this class is after 7 weeks, it's quite high. Okay, so who is the next one? I don't know if you guys understand what I just said, called Kaplan-Meier survival curve. You know, or you don't. Don't worry, we'll talk about it some days. This is a graphic to observe how many people survive after a treatment therapy. So usually after 5 years, you see people die, and that drops just like this, and you see that line going like this. I can grab this class, this Kaplan-Meier curve for you guys, just for your pleasure, okay?
Some people have a duty today. Some people have a duty today. They are on duty. Yes.
That's okay, because some of them will present next time. So just means somebody you like, it's not die yet, so they live again. That's amazing. Oh, this is maybe the only curve go like this, right, Queen? And then you see that number is that will be awesome.
Survivor.
The survivor.
Survivor to be alive.
Well, okay. Who is the next one? All right. Why don't you tell Dr. Zhou what is your topic for today, and then try to make him cry. He's a very tough guy.
Yes.
So you tell about your topic. What will you say?
Hi, Mr. Đỗ.
Hi, doctor.
Yes, I'm Dr. Zhang, and I'm a doctor for your son's Jason.
Yes.
Okay. Last week you come here to see me, and I examine for your boy, and he had he had a headache and a fever, and he throw up. And I suggest to take MRI for your boy, and now and I that you today come back here to see me, and I have yes.
What did you find on the test? My boy still have the same symptom. It hasn't changed yet. What did you find on the test?
No, I last week I suggest MRI for your boy, and now I have some bad news for you. And
What news? What do you mean bad news?
I regret. It's I think he has a brain tumor. It's he has a brain tumor.
Brain tumor. I don't believe this. Nobody in the family has cancer. How could this be? You know, are you sure this is the right patient?
Yes, I checked his MRI carefully, and with his symptom, he had, I think, and I think he has a small tumor in his brain, in the back and on the right side.
Is he gonna die? Is my son's gonna die?
Don't worry. He will be okay. We try our best to help you. We have plans to help for your boy.
What is the next step here? What do I do next?
Okay. We will always be here with you and your boy. We have plans to go into have a surgery to get out the tumor out of his brain.
How dangerous is the surgery? How?
It's had dangerous, but I don't certainly, but we try our best.
What are some of the danger with this surgery?
It can it can after surgery it can have risk. Sorry, I can't say about.
You can try it in Vietnamese and Ấn Độ can help you.
Nhưng mà em không có.
All right. This is week 7. Don't do that. Okay. Don't turn around and ask for your colleague. If you don't know,
Yes.
Can you help me with that?
What problem should I expect with this surgery? Is it like, well, what are the complications of the surgery? What are the complications that I should expect from the surgery?
Yes. I think it has some dangers, but such as bleeding after surgery. He can't I can't speak Vietnamese. Nó có thể là tái phát lại.
Recurrence?
Yeah, yes. Okay. Recur.
Oh, and what are the chances that this surgery is gonna cure the cancer?
You asked me what can other methods to cure the cancer.
No, I mean, what you said, the surgery have the risk, right? I understand that, but I want to know what are the chances that you can help get rid of the cancer, treat the cancer with the surgery? What are the percentage? What are the chance?
Yes, I see. It has a chance to kill the cancer, but he can live with after that he can live with with us a long time, for a long time. Don't.
Does he need chemotherapy after the surgery? Or
Yes.
yes.
Let's stop right here and give him some feedback. Sarah, you want to start with some feedback first?
So first, I think that you try your best, but I don't think that you prepared well enough for this patient, because to me you feel very hesitant when you answer the questions, and you don't give a lot of information. So like when he asks about a chance, like he actually want to know the number. You only give him a vague answer of like he will have a chance to live with us. It's not what the patient expected from you. And also your pronunciation, you need to be more careful with the long word, like it's surgery, not like surgery something. And your intonation, you still have the you always raise at the middle of the sentence, so it makes the whole conversation sound very weird. It to me it felt like you ask a lot of questions in like the way that you speak, because you raise your voice a lot. So like just keep your voice like up and down, but like try not to raise it in the middle of sentence. Try to go like down as you come to the end of the sentence. Will make the conversation sound more natural. Yeah, that's it.
Thank you, Sarah. Here's my comments. I agree with Sarah. How many of you did the spike video today? Did you look at that, the spike setting, and how many of you raised? Please raise your hand, because as I say, I really want you to come to the class well prepared. This is your only time to interact directly with us. So I like you to come here at least prepare, because this is the best way for you to learn. Okay. So what we can do next time is think about how to deliver a message like this. This is a very difficult job. You're not going to learn this over 1 week or 2 weeks, but to give you some ideas to start with, and then in the future you keep working on this skill. But I do see that you try, and that's a good effort. Okay, keep trying, and then if we move on from our career, someday we realize that at least we're doing okay. It's actually today, Dr. Donna and we happen to be in ICU. I just delivered really bad news today, because my patient it's hard to survive. But I will share with you how I delivered that bad news. I mean, the family hugged me after that. It's a very tough moment to do that. Okay, who's the next one?
Just before we to the just one thing before I move on to the next person. I appreciate the effort too, but one thing is that about the complication, it's okay to tell the patient that you're there with them, to support them to get through them, but don't give them false assurance. Like, don't tell them that it's not going to happen, because when it happened, you have a bigger problem. So just be honest, say, this is the possible complication, but we'll try our best to minimize it. And if there are possible complications, there are ways that we can deal with it. I think that's better than say, oh, there's no complication, or don't worry about it, because that will be a big deal later down the line. That's it. Yeah.
All right, so are you ready? Okay, so what is your topic today? And who would you like to be your patients?
I want to work in Winton.
Okay, sure. So what is your topic today? What would you like to deliver?
Today I will talk about congenital heart.
Okay.
Your daughter is 6 months.
Okay.
Come to me because she has a slower gain weight.
Okay.
Yes. Hi, Miss Wing. I'm Dr. Thảo. I'm a cardiologist.
Hi, doctor. Thank you. Thank you.
After you bring your daughter to hear me because she has a slower gain weight, and moreover she has poor feeding. Sometimes she's breathing in the sleep, and she has a purple in the cry. Okay. After a careful examining and doing exactly echocardiography, I want to say you bad news. I want your family prepared spirit to accept my information I will to say you. Okay.
What happened? What happened to my daughter?
Your daughter was congenital heart. Do you know this disease?
What is that? I thought she's doing just fine. She's just a little bit weak.
What you say?
I think she's okay. I think she's fine. Why you think she have what is congenital? What is that?
After I careful examine for your daughter and do some tests such that X-ray and echocardiography. I release your daughter was congenital heart.
What is congenital heart?
This disease appear in pregnancy, and is.
So you said my wife had something wrong during her pregnancy?
Maybe in your pregnancy, your mom in flu, or maybe has influenza virus. Okay.
Well, I'm not sure. I don't recall my wife. She did. I mean, her OB told me that she had a very healthy pregnancy.
Is have many reason.
Mhm.
Okay. Yeah.
All right, let's hold right there. Class, any comments, any help? You guys can come and help. This is a team effort, and I want you fully participate in this class.
So if any member in our group who have a help, you can speak it louder. Yes. So have to continue on.
So tell me, doctor, I don't understand what is congenital and what happened to my daughter. Tell me.
Say about the congenital, say about describe about the heart, is there a hole in the heart or something like that? Describe what kind of disease you want to say? CD.
Yes, I can speak Vietnamese.
No. Try speak in English first. There are some cases, some so you explain about the congenital heart. It means heart disease. There is a defect in
All right. So I want one person. I don't want the entire class. Just one person speak loud and clear and help her.
There is a defect in his heart.
Okay.
Is there a hole between
Think louder.
There is a hole between two chambers in his heart. It's called ventricular septum. That's the defect.
Okay.
Okay. And it makes his heart not work well. Don't work well.
Okay. So what does it mean? Like my daughter, not son. So my daughter will not survive.
No, she can.
Yes, no. Yeah.
She will survive. It's just a small defect, and we will. And it can be treated by a small operation.
I see. Okay. And how you sure that the surgery will fix her heart?
Yes, we will surgery for her as soon as possible.
Okay.
Okay.
All right. And okay. Well, wait 1 second. You said that you're gonna open my daughter's chest apart and they fix that?
Yeah, yes.
Have to open the chest.
Yes,
No, so yes.
No, no. So then I don't want a surgery. Okay, she's too young. She's too little. This is my angel. I don't want anyone open her chest.
Intervention.
You can say you can follow for 1 or 2 weeks or later.
If you intervention, not operation.
We will. I think your daughter must be. I will. Your daughter must be surgery as soon as possible, because if you want to delay, your daughter will be have many symptoms. Okay, and you will be have heart failure in the future, and after that we can do surgery for her to help her have a good health, good health. Okay.
Okay. All right. Let's stop right here. I like you to spell heart failure.
Yes. Heart failure.
And you guys know that we have a cardiologist today. Okay. So let me tell you this. When you like to deliver a bad news for a case like this, usually we ask the parents how they understand about their daughter or their son conditions. Because this is what you always want to start first. You don't want to tell something. This is how I would start. Mr. Win, did you or have you noticed your daughter become fatigued lately, or she has some problem? And then, of course, yes. You ever wonder why? And then he will, well, I'm not sure. And then you can go on and say, you know, her heart, it's a little bit, there's some problem with her heart. And you wait. And then say, what's wrong with my daughter? And then you can so on. You know, our heart and her heart, we have 4 chambers or 4 rooms. Don't use chamber, 4 rooms. And the 2 main room to pump the heart out. Usually there's a wall in between. So one room is pumping, blood go this way. If there is a connection between 2 rooms, so the blood can go, and when the heart try to push water or blood out, it's not good as usual. And then you wait. And that's how you deliver a ventricular septal defect. You don't want to say something like ventricular septal defect, because a lot of time, yes, the patient may or parents, they can understand, but I start with basic information. Remember, we're talking to an 8th grade. One thing that I try to emphasize over this course is your patient, no matter how intelligent they are, they like lay terms. They like very something commons. Okay, just to ask for the entire class. Okay, so you should know this. How many chamber a human heart is? 4, right? So name an animal, and an animal or animal have 3 chambers. Heart have 3 chambers. Tell me.
Frost.
Okay. How about 2 chambers?
The fish.
Yes. How about 1 chamber? Okay, so 1 chamber is not compatible with life. Okay, so there's no such thing as 1 chamber heart. But my point is, I remember when I deliver this, actually, to tell my patient about heart problem, I tell a joke about this, and I tell, hey, you know how many chamber a turtle has? And then you kept easy the feeling a little bit, and then you can go on and say that. Okay, so this is just one trick. Okay, now let me let the cardiologist explain to you in the professional way. Go ahead, Queen.
I think you did a great job, doctor. Both of you guys. I didn't know that the other animal have less. I only learned about humans, so I learned something new. But I think I think it's a difficult topic, especially heart disease is complex, especially congenital heart disease. But I think you did okay with the help. I see the effort. But at the end, when you ask the parents and they say they want the surgery, instead of telling no, you have to have the surgery, I think it's best to tell them the benefit of surgery. Like, having the surgery will help your child grow better, develop better, give more oxygen to the brain, increase their intelligence. And if you delay it until you have heart failure, the risk is you're still going to need the surgery, but the risk is going to be much higher. So tell the patient, the benefit of the procedure too, so they can see why they have to do it now rather than wait. And instead of maybe use something that is lesser than like bad news. I have bad news to deliver. I want you to have your spirit ready or something. Just said, we have some tests and some of the results are not good here, and then we can start discuss about it. Maybe the word bad news or prepare your spirit, sometimes it's a little bit strong of a word to use with the patient. I think that's about it. Yeah, it's a very complex disease. Over here, there's their own specialty, their own specialty just to deal with congenital heart disease.
Thank you, Queen. Sarah, any comments on this?
I just want to tell you that whenever there is a congenital defect happen, just try not to blame the mom. Because like when the father asked you like why did it happen, you said that maybe because of the mom have this and that. It's just gonna put the guilt on the mom. Just try not to say that some congenital just happen. It doesn't need a reason to happen. So just try not to say that. You just explain it to them that like during the development, sometimes the development goes wrong, and there might be some like abnormal development of that structure. Just try not to like get the mom into the equation. It makes things like much more like harder to explain to the father.
All right. Thank you, Sarah. Okay, so here two things that I noted here. Well, Sarah mentioned that do not blame on the mom, and also when they after surgery, a lot of time, if the patient not ready, don't push and don't say yes. Just wait. This is a big, and then I don't know if you have a daughter, you have family yet, or you single? You have family?
No.
Okay. Well, it's actually this is difficult. But I wonder if I have a daughter and somebody told me that they need to open her chest, I will be like freaking out. I'll be honest, because this is the big deal. Think about it, and pay attention to your patient. If they feel overwhelming, just stop right there and don't push. A lot of time, this is an art, this is not a science. So I told my residents, student medicine actually has composed 3 branches: science, art, and now there's a new brand called business or money. Okay, because if you don't do business well, you out of street. So now medicine today has 3 branches, not just 2, art and science. So I call the art, science, and business of medicines. Okay, in art medicine today, we wait and we talk. And if the parents, they okay, then you give more, just like you're feeding someone. Okay, so next time, try to pay attention to the parents, because if he's overwhelming, just hold right there. Okay, questions?
Questions? Yes, I have some question for you.
Okay.
Yeah. When I want to say your family to say that I want to a surgery for your daughter.
Mm-hmm.
I have to say how I have to say.
Okay. As Dr. Dahl mentioned, this is a very complex, and unless you are a specialist, okay, this is how I approach. Let's assume I'm a specialist, and this is I would just usually say, based on my experience and what we've seen over the time here at a hospital, similar situation like your daughter, if they don't have surgery, or if they have surgery, many of them are doing well. As you see, there's a hole between the 2 rooms, and over time, your heart and the daughter heart become weaker. We concerned someday that the heart failed to pump, and you stop right there. Okay, I'm not sure if Queen you have, but this is how usually I do this a lot of time with my expertise, and I use say that this is my, and based on this, and this is how we say. Anything on that, Queen?
Yeah, so I would echo that. I would say the same thing, but usually when you mention the risk, people will say, why would I do this? So I usually end it by saying, you know, whenever we do any procedure, we weigh the risk and the benefit. And in your situation, you know, your doctor, your refer doctor, the specialist feel that your daughter would have a more benefit. Even though there's risk, she would have a more benefit than the risk in this situation. And then you tell them the benefit. And in the end, most of them would be okay if you tell them that, you know, we and to mention that we don't do these procedure for every single case, but in your case, the risk we feel that outweigh the benefit. So that's why your doctor and us, we all the team decided that she should have that.
Yeah. Thank you. Any other question, class, before we move on to the next one? Okay, again, I like active participant. Okay, think about it, and because this is your time to practice, and this is your time to speak. Question before we move on? Any question?
No.
Okay, good. Okay, thank you. Seven more people, right? Let's keep moving.
Hi, Mr. Wins.
Okay. So tell me, what would you like to deliver today?
My case today is a child, a 1-year-old boy. He was bring in the clinic because his parents look him pale.
So what problems? So what is the problems?
And the problem is he has thalassemia.
Thalassemia. Okay, let's do it. Thalassemia. Okay, I'd like you to spell it correctly.
Yeah. Okay. Thalassemia.
Okay. All right. This is a quite interesting. I like how you guys explain this. Okay. Why don't we? So you pick one. You have not many choices today. Me, Queen, or Sarah. Which one you want?
I want to speak to Sarah.
Okay, Sarah is the favorite mom. Okay, she's a really good mom. Mom just in this class. Okay.
Hi, Sarah.
Hi.
Nice to meet you. I'm Dr. Lee, and tell me, how can I help you today?
So my son looks really pale. That's why I bring him to you.
And tell me a little bit about. Tell me a little bit about what's going on with him.
No, he looks okay. He a little bit less active than usual, and he looks really pale. So that's why I bring him to you.
And recalls when you take him for me, and after we examine him and takes some tests, and I'm sorry that I have a bad news for you. And it looks like he has thalassemia.
What is that?
It's inherited disorder blood. And could you tell me your understanding about his conditions?
Like, no, I don't know much. The only thing I know that he looked pale and looks a little bit less active. So I brought him to the ED. they took some blood. They said that they will explain it to me more after the result. So that's all I know.
And thalassemia is inherited blood disorders. It means that at least you and your husband has um, a careers. And the problem is that he will have chronic low red blood count.
So what's it's gonna affect my child health? Like, what is red blood cells and what does it do? Because I don't know much about medicine, so can you explain it more clearly?
And red blood cell is a cell in your blood that carries oxygen to many organs in your body. And if your child has low blood count, he will feel tired, and he will delay development, and he will have bone deformities, and he will has heart problem, and it depends on the severity of his disease.
So what should I do?
Well, we can help you. You should bring him to our clinic to check his blood every month, and we will know when he needs blood transfers.
So we are religious people. We don't want our child to receive any blood transfusion. Is there any other option?
I know it's really hard new, but the treatment for his condition is that we can blood transfer for him, or the other option is bone marrow transplantations. But it's hard to find the persons who but it's hard to find a person who mess with his bone marrows, and it costs a lot of money. So,
yeah. So we have the mean to do that, and I want to try that because I don't want my child to have to go through blood transfusion, and we don't really have time to just like visit the clinic every month, as you say. So like, is there any way that I can monitor him at home that I don't have to bring him to the hospital every month?
sorry, I don't catch your words.
Like we live far away from here, so we cannot get here every month. Is there any other option that I can monitor him at home?
Oh, I know that is it's hard for you, but it's really important to check him every month, because he will tire us, and tire us, and has more health problem if we don't check him frequently.
Okay. So is it a curable disease, or my child gonna have to live with it for the rest of his life?
It's Sorry, you can speak again.
Like, is it curable? Can we cure it?
Yeah.
Can cure the disease.
Cure, the one thing, the only treatment that can cure the disease is transplant, bone marrow transplant that I have started to use before, but it has some difficult and it's cost a lot of money. And
Okay.
yeah.
And you, yeah, just one question. And you said this is an inherited disease, so did I give it to my child?
Yes. It's inherited disease. It means that one of you, you or your husband, has give disease to your son, but I don't know what who of you. So and I think that you could as you should
Screening.
I do screening before you has another child.
No. Okay. Thank you.
Yes, thank you, Sarah.
All right, thank you. All right, so Queen, go ahead.
I like to start with some of the positive. I think, you do very good with the open-ended questions to start out with. Say, tell me about your son, just to allow the patient to, go tell about, what she knows about her son, what the symptom. And then I really like your explanation on the effect of the disease on the condition, not using too many medical terminology like the carrying oxygen to blood or to different organs, so that people can understand. And then you did use some like jargon, like, you guys are carrier of the disease. Sometimes it's probably hard for the patient to understand that. And when the patient said that they they don't like to go to the clinic, they don't like a transfusion, I think the right approach would be say, I understand and I respect your belief, but this is related to your child's well-being. We will try all those options first, the medication, explore the option of transplant first, and if necessary, we should discuss that the patient get transfusion. But just given at least the belief that you want to try other things first, and you respect the belief, because some people are very strong in the belief. I can tell you that people who don't like transfusion, they rather die than have a transfusion, and that's just, you have to respect that. You can't just ignore that. Yeah, that's it.
Thank you very much, Queen. I concur with Dr. Do mentioned many points, but what I like to challenge you and the entire class is, whenever you talk about congenital or hereditary disease, this is a very sensitive thing, because you don't want to tell the parents, hey, this is you create a problem for your kid. By talking to a different way, you can ease that feeling. For example, you will say, well, we're not sure, but this disease, for some reason, we're having from this generation to other generations. It's not about you, but it's because of a gene. And then you wait, you see how the parent responds. Sometimes some of them very upset and wonder why they create these problems. And again, it is an art, because you have to realize that mom in particular, many times they feel guilty. And not, you have to read one more thing, not all pregnancy or kid, they were born happily. Or most of them are very happy parents, but some of them are not happy parents. And if you pick to the point that, for example, the mom was a drug addict before, the mom was having some problem, divorce, I mean, you bring entire social issue to your medical situation, and that's not good. So I challenge you and the entire class, whenever you deliver this kind of news, pay attention to the mom. And if she tell about her religion, like Sarah in this case, they don't want transfusion. You acknowledge that and you say, we respect that, and we do something that tell the parents that yes, your concern is here it's here loud and clear, and that's what your response. Okay, any questions?
Any question? No. No.
Can you repeat the word your concern is? I cannot catch.
It's heard loud and clear. So this is a way that American people would say, just like, okay, we understood, we hear you, we heard you, but you said it's yes. So that's how you say that. It's more like a cultural thing that many times the way that I do is I just look it into their eyes and acknowledge. And this is one thing that I wish to tell you, the body language play a big role, big role. So I encourage you to look into the screen and try to interact with your partners or your patient today, and try to create a habit that when you look into their eyes, okay? We're not talking about a dating day today. Well, dating, remember how you date a guy or how you date your girlfriends? You look into your eyes, right? Then look how lovely, beautiful she is or she is. Think about it and pay attention to your patient that way. Okay, you find amazing that many times you look into the parents or the patient eye, and you see some connection there. All right, next one.
Hello.
All right, tell us your topic, and it's your choice. You can pick one of us.
My topic is meningitis.
Okay.
And up to you.
Dr. Doe or me or Dr. Sarah?
Dr. Khuyên Độ.
Dr. Khuyên Độ. Okay.
Hi, doctor.
Hello, Mr. Độ. I'm Dr. Khuyên. Nice to meet you.
Nice to meet you.
Yeah. I'm responsible for the treatment of your baby. And as you know, your baby has fever one day, and then tonight she has a seizure, and after and you know we do a lot. We do a lot of examination for your baby. Example, blood count, blood counter, and lumbar puncture. And now I have the results of cerebrospinal fluid, and I have bad news for you.
What do you mean bad news?
Your baby has meningitis. Do you know meningitis?
No, what is that? Is that an cancer?
No, this is inflammation of meninges, and it's by bacteria and sometimes by virus.
So is this dangerous?
It's a severe disease.
How did it get there?
Now we will meningitis has been by bacteria bloodstream, and go to brain or inflammation of
a rear beside a brain such as ear.
So what do we do now? What do you propose us what to do next?
Now we will use antibiotics, broad-spectrum antibiotics by venous for your baby, and maybe use corticosteroids.
Is it safe for kids to have medication, antibiotic? Is it safe for children to have antibiotic?
Yes, but because delays treatment, the risk of complication increase. So we must use antibiotics for your baby.
What are the side effects of the antibiotic?
Yes, every dose has side effect, but we can accept this some side effects. We can control the side effects of antibiotics. Example, failure renal, liver failure, and when while treatment, we will check function of her organ.
So you said my child have a chance of have failure of the liver and the kidney with these medications?
Yes.
Are there any other way to treat this without these medication?
Can you repeat again?
Is there other way to treat the meningitis without the antibiotic?
Yes, antibiotics is very important for this disease.
And how long is she has to be on antibiotic?
From 10 to 14, but it depends form of bacteria.
Is it contagious? I have another child at home. Should I isolate this child from the other child?
Yes. Maybe because giai đoạn ủ bệnh gì hả? Nó giai đoạn ủ bệnh but không. You must monitor your and you must follow him at the home if he has similar symptoms as his sister. You can bring him to see me.
Okay, thank you, doctor. I'll trust you.
Yeah. Any question else?
Okay, good job.
Yeah, good job.
Feedback.
I think it's a very difficult subject to discuss, but I think at beginning you do use a lot of medical jargon like meningitis. You know, I think maybe explain it in a less with like maybe infection of the fluid around the brain and the spinal cord maybe, and then I noticed that you guys use the term examine a lot. I don't know what the other two doctors think, but for me, examine for me is more like a physical exam. I like to say evaluation, complete evaluation. That means includes an exam, lab, X-ray, everything. So I just use after a complete evaluation, or you can say examination too, but I guess, but I noticed you guys use the term examine a lot, but usually evaluation is probably a more comprehensive term that includes labs, x-ray, and everything else. But I think you did a good job with a difficult topic. Maybe less medical terminology would probably be useful for the patient. Yeah.
Sarah, any comments before I jump in?
Yeah, I think you did quite well. Yeah, the meningitis, it's hard to explain, but I think I saw my attending explain it as a thin membrane surrounding the brain that get infected. That's how they explain the meningitis. And there's some pronunciation, but I think it can be fixed easily. Yeah, I think that's it. Overall, it's pretty good.
I agree with Sarah about the how you explain, and I challenge you and entire class think about this. How would you explain those terms to a patient? Because meningitis to a patient, it sounds like something that completely foreigner. I'm sure they won't appreciate or understand. So I would start with something like Sarah said. You know, in the brain, there's a very thin membrane that covers the brain. And sometimes it gets infected, and that's this condition like this. And that explains why your child have headache, and he have some pain, or he have some pain in his neck, his problem when they try to knock down, or those are the symptoms that you try to explain that fit the picture of the membrane that infected, and that will give the parents, and that also explain why you need a lumbar puncture. And you see that's why we need a little bit fluid around this membrane to see if there is infection or bacteria or something. Does it make sense? So that's what I like to start with. And when, again, give small piece of information, direct, and wait. Okay. Any question before we move on to the next one? Okay. All right. So keep moving on. How many more we have left? I think we have to move faster this time. Two? Okay. Good.
I will the last but not least.
All right. Keep going. Hello.
Nice to meet you.
Nice to meet you. Okay. So tell us about your topic and who would you like to deliver that news?
The topic today is I tell the patient the symptom after taking and after asking HPI and explain do some test about leukemia.
Leukemia. So that you would like to tell the patient that he or she have leukemia, correct? Yeah. Okay. Yeah. All right. Who would you like to? It's Serena just off the door 9, so you have 50-50 chance. Okay, go ahead. Who would you like to talk to?
You.
And me?
Yeah.
Okay. So go ahead.
Hello, Mr. After checking your child, so I see your child symptom similar likely with the blood disease. So it called leukemia.
Okay, so is it a blood disease and it's called what?
Leukemia. You know about that?
No, I don't understand. What is that? Is that something else? What does it mean?
It called blood cancer. But worry, just my expectation. It's not sure.
Okay, so you telling me that my child had cancer, and now you're not sure.
So because I say that my expectation, so I need to do some tests to measure my diagnosis.
Okay, so you were suspect or you concerned that my child may have this condition, but you
Yeah.
want something. Okay, so how do we confirm that? How do we confirm that conditions?
Can you put it another way?
You told me that my child may have leukemia, and you suspect that. That's your concern. But now you're telling me that you're going to do a test or something to confirm, right? All right. Okay, class, again, rule number 1, don't look at me. Don't look around, okay? In real life, I don't want you guys just look around. This is very unprofessional. Let me repeat again. It's not, okay? If you don't understand the question, ask me or ask the presenter or the one that you're talking to. Okay, try to do it as a habit. If we don't understand or we're not sure, we just ask, okay? And let's keep that moving, okay? And your class, if you want your classmate, just raise your hand and say, hey, can I jump in? Can I help? And then of course you can go ahead and do that. So let's do that. Okay, keep going.
Please tell me what do you mean?
Okay, so my question is, you telling me that my daughter may have leukemia. How are you sure about this?
I told you before that it's just my expectation that your child's symptom has fatigue, bleeding, easy bruise, and anemia.
And anemia, okay.
Anemia, yes.
Anemia.
And so
Wait.
after that, I want to have some tests for your child to make sure my diagnosis. It's just my expectation. Don't worry about that.
Okay, so you don't think my daughter had leukemia? So you don't think my daughter had cancer?
No,
Wait, doctor, you just told me that my daughter had cancer, and now you don't think my daughter had cancer.
No, I find your daughter's symptom similar leukemia. So I tend to.
Okay. Well, doctor, I'm confused. Tell me, my daughter had cancer or not?
I'm not sure. Just my expectation and.
Okay. Let's stop right there. Can you guys reduce the background noise? It's very noisy, so I'm not sure if I can hear that clearly. But okay. So you, in this case, actually, let Dr. Do has some comment first, and I will.
I think you say you want, so pretty much you want to do a bone marrow biopsy to rule out cancer, but you haven't expressed to the patient, with confidence and why you believe that. So you can say, based on your symptom, your preliminary, your lab result, your certain cell count is very high or very abnormal, that lead me to suspicious of something more dangerous, and I want to do a bone marrow biopsy to rule out or instead of say confirm, because if you say confirm, they mean that you already think that they have cancer. Now you just want to confirm it. Say to rule out something, you know, malignant or cancer itself. You can say that too, but you have to give them a better reason to do an invasive test, and you have to be confident of, you know, because from the interaction, I think the patient can feel like the doctor does not know about my child's condition, and the doctor wants to do a very invasive procedure. So that may be very difficult to convince them that. So either you said these are the reason why I'm suspecting it, and I want to do this test to, you can say confirm, to confirm my suspicion or to rule out something dangerous. You can say that, but you have to know the background, like why you want it. You have to show the patient why you want to do it. If you're wishy-washy and ask them to do an invasive procedure, that's very difficult, and doesn't create a lot of trust between the patient and you. That's it. Yeah.
Thank you, Queen. Here's my comment. When you like to tell a patient about a diagnosis of cancer, if you're not sure, don't say that, because this is a very difficult, critical. Cancer is something that very, and in general, any diagnosis is not just cancer. I would not say that until you're really clear. You can say this. You can say the symptom of your daughter and all the symptom and the lab concern for a condition called leukemia. And we need to do some further tests to make sure whether your daughter has the condition or has not. Okay, and you can say that, and no one will blame you on that, rather than you say, oh, I think you have or expect, and then when I ask you that, you say don't know. It's very, you know, as physicians, the trust is a bonding between you and the patient. If the patient does not trust you, everything else become a disaster. I'll tell you, the trust is so important. Trust is a big issue here. How do you gain trust? Again, this is an art. This is not a science. This is not business. This is an art. And the way that you talk, how confident you are, how reassuring and how dedicated and sensitive will make the patient trust you, right? Just like you like to tell about your products, about something that, but you're not even confident about yourself, then people won't trust you, okay? And to me, in cancer, on oncology, trust is a big issue.
I have a question.
Yes.
And what should we say? We tell the parent when we suspicion like that, and we have no many tests, and we.
If you're not sure, then we say we don't know. I'm not sure that's your question, but here another topic I like to share with you someday, to say I don't know. Okay, in medicine, this is a very hard thing to say, because the patient expects you to know everything, but sometimes just simply say, we're not sure, or we don't know. And that will show your honesty. It doesn't mean that you don't know. It doesn't mean you are not a good doctor, or you're not a competent doctor. But from what I learned from my trainings and the way that we train here in the US, telling patient, I don't know, or I'm not sure, it's okay. But I know Vietnamese culture, it sometimes could be differently. It's hard for you to, so I'm not sure if that's your question, but if I'm not sure about the diagnosis, I would say I'm not sure, and we try our best. So here's the one thing. I always say, tell my patient, I don't know, but we try. But we will try our very best to figure out what's wrong with your daughter, or find what's the best treatment for your daughter or your son.
So just one last point on that. You mean for my job, I see a lot of people who had, like, you know, syncope, all of a sudden just pass out. So they refer to us to say, okay, can you find out why I pass out? So instead of saying you have a heart attack or arrhythmia that caused you pass out, I said, you know, we don't know, but you know, one of the most common cause of sudden pass out is arrhythmia. Now let's see how we can figure it out for you. Let's do, you know, do this procedure that can stimulate your heart and to bring out the arrhythmia if you have it. Now I also tell them It's two possibility. Either we find that you have a arrhythmia that caused you to pass out, which is unfortunate, but we have a way to deal with that. Now, on the other hand, if we do this study and you don't have it, it can also give you a reassurance that you don't have anything dangerous or life-threatening. So you give them the what is the study, what are the expectations, and how you're going to help them with the result. So for this case, you can say, we're not really sure, but based on your child's symptom and the lab test that we have a concern that she might have something malignant or cancer. Now, I would like to do a biopsy to confirm whether she has the condition or not. Now, if she has a condition, these are the things that we can do to treat it. If she doesn't have condition, is also a good thing. Now we don't have to worry about. We can look at other things. That's it. Yeah.
Thank you.
All right, thank you. Let me see.
The last one.
Yes.
No, not the last one. Will be the last one.
Just want to make sure that, hey, do we have Dr. Ho? Yeah. So I would let you guys do. Dr. Ho, we always put our code on the group, the Da Nang group. So every Saturday mornings, and so here we are. This is the last patient of the day, but you were special. So said, oh wait, are you playing guitar for us?
No.
Okay, go ahead, Thủy.
Happy birthday, Dr. Phú.
Hả?
Happy birthday.
Hả, ai vậy?
I don't think about the birthday of you on Facebook. You know, think that today is your birthday, right?
No, birthday every month.
Everyone, right?
I get a birthday every month, so I get more present.
Yes.
Okay.
All right.
Thank
So
you.
Yes. So we're moving to the last patient, Dr. Ho. Okay, go ahead as usual. So you're going to tell us about your bad news that you like to deliver today, and you can pick any of us. Now you have one more option, either me, Dr. Quinn, or Dr. Ho. But I strongly recommend you to pick Dr. Ho because he just come to this group. Okay, go ahead.
Today I want to talk about septic shock. And I want to talk to Dr. Winter.
You like to talk to me? Okay, then Dr. Ho will give you feedback. Okay, go ahead. And what are the situation? Tell me.
Hi, Mr. Winter. I'm Dr. Ân. I'm your son's doctor. Your son have a fever 3 days and diarrhea, and now we are trying to treat for him. But now I'm sorry to tell you that he found in septic shock. Do you know septic shock?
No, I'm not sure. I don't know what's going on. One thing I know right now is my son is in ICU. I mean, but he had diarrhea all the time. I'm not sure why this time he looks so weak right now and he's so sick. What happened, doctor?
Yeah. Septic shock is a severe condition in which his organ don't run as usual, and his heart don't supply enough oxygen, not enough blood for his organ. And I want you to know it is a severe condition.
Is he gonna die?
Maybe we will try our best. But in worst case, maybe he can die.
I'm not sure. I mean, how could I explain to my wife? She's on her way here, and we think that it's just diarrhea. Yesterday he was fine, but today he's in ICU, and now you're telling me my son is going to die. Why?
In most cases, diarrhea can recover in from 5 to 7 days, but in some case, infection condition can be worse. And in your in case and in your concern case,
Doctor, I'm shocked. But you said something septic shock. What is that? I'm shocked too. So what is that shock?
Yes, some infection
That time out, guys. It sounds like somebody tried to tell you something. I like that person come up and explain, because this is, I mentioned the rule of this class is you either say loud, or if you want to help your colleague, come out and talk. Because let's do that, okay? Let's do together, and don't say that, okay?
Hello, Wing. The diarrhea sometimes they can recover quickly in 5 days, but some cases it can be severe. So your son is one special case. Until we have to take care of him so much, we control the diarrhea, we infusion the fluid for him, but we cannot control the toxicity of the bacteria. So it can to many organs, and this can the word septic, like Dr. Ang has been said. So the septic is two more organs in your baby may be infected by the bacteria. So it's it infect him too much, and it can.
Doctor, I'm here. Please look at me.
I'm sorry, another screen here, and I look at the bigger screen. Yes. I'm sorry, I'm familiar with the bigger screen on the TV, so I'm looking there.
My apologies, yes, but either way, look at your patient, okay? I thought that you look someone else and talk to your patient like that.
Look to you, but in another screen.
Okay, that's all.
Okay. So continue.
Yes.
Or you have another question?
No, I please continue.
So now we will try our best to help your son see in the intensive care unit, and we will take the antibiotic for him and follow the heart rate, the
Some medicine to support.
you can say.
And now we will change a stronger antibiotic for him, and we will use some medicine to support his heart to do better.
Okay, please help my son. Please help me.
So he may be down.
Yes, we will. Yes, we will try. We will try our best.
Okay.
But I want to reconfirm you that the disease of your son is so severe, and our team will try our best for him, and we will contact you if there is something different as quick as possible.
Okay. Just one more question. Now you mentioned that my son maybe die. You know how soon it will happen, or what is the expectation that I should tell my wife?
I'm sorry that I'm not know exactly the time, but the condition of a child can change so quickly. I suggest you that you should call your wife for her to know about the condition of your son. But maybe you can. I think that can be should like you when he heard about this. So if you find it so difficult, our team will can say to her about the condition of your son.
Okay.
Yes.
All right. All right. Thank you. All right. Let's come out here and have some feedback. First of all, I thank you for your help with your colleague. As I say, next time, if you guys want to help out your colleague, just raise your hand and come up front, okay? And we don't like the talk on the back, say, hey, do this, do that. Okay, feedback time. Dr. Ho and Dr. Do.
I think we should do a role play so they can see what they can learn from
Dr. Do and we are about to do that, because I just told Dr. Do that I have a bad news today, and we do exactly. I met you in ICU, so I will do that with Dr. Do. 1 second. So feedback first, and then Dr. Do and I will show you guys how to, and we all give feedback how I deliver bad news to a patient, a real one actually, just today in ICU. Okay, go ahead, Dr. Do or Dr. Ho. Any comments on these conversations?
I think for the learning, because when the candidates speak English, it might be difficult, but you need to show some empathy. You show your emotion. You have to release your emotion. I think that one of the PowerPoint I sent it to you last week. You have to show emotion. Even you cry, you hug the patient. You do all many like thing you can do. Can show your emotion. You cry. You do that normal thing. Just the cold face, or that's not the right thing. The second is, when in this event, I prefer not to use any jargon like septic shock. It might be difficult for the patient to understand, especially in critical condition. Thirdly, you need to know what a septic shock means when you explain clearly to the patient, this is bacteria, or the toxic release of bacteria can damage all or every organs in the body, can cause the body shut down. A simple term, easy to explain. And other thing, if you got not sure, you have to say, I'm not very sure at the moment. I'm not sure what the prognosis is, But I will get, our team to come get together, and we'll have the meeting. We will discuss the case, and any, news, anything we update to you, regularly. Or the other thing, if you think it's very critical, you will call the family conference. Everyone has to be involved. This one, discuss all team. I'm not sure in Vietnam, but we got a social worker, got all, other team, allied health team to support. There's something you need to get a bigger pictures when you're in and you involve this case, you have to manage. But again, I think because when you practice the English, I don't see any empathy at all. Show your face, expression, verbal and non-verbal. When you talk to the patient, they need to be a bit more, in the tone. When you talk about the tone, you have to be good. We can see that you're sincere when you talk to me, at the patient. So probably, I think, this is a long way to learn, and maybe Dr. Doe and Dr. Win will do the role play and see how to express the emotion, how to express the feeling, and the tone, and, the sound will be like.
All right, before we move to the role play between me and Dr. Quinn, I'd like to say two things about this. Like, I like to see more active participation from the class. If you have any idea or comments, you just raise your hand, because this is your chance to talk, and this is how we learn as a team. I hope you're not going to be afraid. This is your week 7 already, and everyone here, nobody gonna bite you. Okay, no one's gonna hit you. I know that yesterday when you guys Vietnamese Women Day, so that's another reason we're not gonna bite you. Okay, so Dr. Quinn, I'm going to present this. You are Mr. Holy. Your wife is a 55 years old, completely healthy. She present with about 4 weeks of shortness of breath and progressively have respiratory failure. I mean, I'm using term right now, so Quinn up to date with what's going on, and then end up with bilateral infiltrates, and we're now concerned for alveolar hemorrhage, and admit to ICU, have to put an ECMO. Okay, so now Mr. Moley had no idea about what's happening. I'm going to tell him what happened, and he and anxious condition, what happened, why his wife. Are you ready?
Yes.
Mr. Moley, my name is Dr. Tran. I'm one of the rheumatologists on team today. How are you feeling today, sir?
Good, Dr. Tran. I'm very concerned about what happened with my wife. I want some update from you guys.
Well, I'm sorry. I'm sure you see that your wife is in the ICU bed right now. Could you tell me what is your understanding about your wife's condition?
Dr. Tran, she's a very healthy woman, but she complained of some difficulty breathing. And when she came to the hospital, I thought it was just a viral infection. And next thing I know, they called me and said now she's in ICU and like requiring like support. So I'm very, very concerned. Can you tell me about that?
Yes. So your wife, she's in critical condition. She's in a very serious condition at the moment.
Critical condition? What happened?
She had blood in her lung.
How did it get there? Like, how did it get there?
There are conditions we call alveolar hemorrhage, or the term for bleeding from the lung, from the small cell of the lung.
Okay, and how did she get it?
At this point, we suspect she may have an autoimmune condition, a condition that her immune system or her white blood cell attack her organs.
But she's 55 years old. How come she never had this before? Are you sure this is the situation?
Well, from the lab and from the study we haven't so far, we also evaluate for other conditions such as infections. We have an infectious disease specialist on team. And at this point, we do not think she have an infection, but rather this is a process that her own immune system, the defense system, attack her organs.
So how serious is this, and what can we do?
As you see right now, she's in ICU and she have blood in her lung. And the good news is we control the blood. She no longer bleed. There's a test called hemoglobin. We test blood in her, the number of red blood cells in her body. And this number is stable, suggested that her bleeding condition had stopped.
And if there's blood in her lung, how is she gonna get oxygen? How is she gonna breathe?
That's why you see there's a tube we put in, we call intubation. That's why we put a tube into her lung and we helped her breathing.
Okay. So what else are you guys gonna do to try to stop or reverse this process? She can't have this for forever, right?
Yes. So first of all, let me tell you what we think the diagnosis. This is a very rare condition we call a dermatomyositis. In this condition, the defense, so generally speaking, we have our white blood cell to defend from infection from outside. In her case, the defense system attack her skin and attack her lung and cause the bleed.
Mm-hmm.
That's what we think so far. In order to control these conditions, there are several ways that we use. First of all, we have to control the immune system, her defense, and at least to stop it.
But if you control the immune system, would that cause her to have other infections?
You're right. That will increase her risk of infections. But in this case, the defense system was so strong, it attacked the lung. So we use chemotherapy agents to suppress or control her defense system.
And what is your expectation for this treatment to work?
Generally speaking, similar condition like her, we see some response. Many cases, there's some improvement. Many won't.
Okay, I put my faith in you, doctor. Thank you for the information.
Any question for us?
Not at this time. I'll let you know.
All right. There's one thing I like to assure you. Here in ICU and everyone on my team, we keep you posted if anything change to your wife conditions. This is your cell phone number, right? I'll make sure that you have the correct cell phone number. And one thing I like to tell you, make sure to take care of yourself. Take care of your daughter. Many times we see patients in ICU, they pay too much attention on patients. And many of them don't sleep, don't eat, don't take care of themselves. I can assure you that it's our job right here in ICU to take care of your wife, and we like you to take care of yourself, and we keep you posted.
Thank you so much. I really, really appreciate that.
All right, thank you.
Thank you.
All right, class. So this is the bad news that I delivered to a patient on ECMO at the moment. She had to put on an artificial lung and heart machine, and I happened to see Dr. Quinn in ICU too. So this is a real situation. And after I delivered that, the husband and the daughter hugged me. I'm not sure if I'm doing a good job, but I can feel that they feel comfortable, and I think that's our goal. Okay, and feedback from Dr. Ho and everyone from the class.
I think the class, you look at the way how Dr. when presenting, he follows SPI, SPIKES. I think the last one he forgot to summarize, the whole thing, but he invite the patient information, put input information from the patient. The setting is different, but the perception have to know what the patient understand, what the problem is. You let them put in, and invite them to information in. And the other thing, might be the time too short, but usually we got all information, the lab, all the result, we can show it to the patient, can talk to the patient in clear term. And I think that's the way how we express our feeling. It have to be sincere. You're not just because day to day our work and we go so quickly. Sometimes break a bad news could take half an hour even, to talk to the patient, give them a lot of times to digest the bad news. And he explained the patient quite clear this condition there, but we also give them a bit of a hopeful tone that I know the condition is very severe, but we might be able something may try to help her, this way. I'm not sure how good it is, but I've seen some literature show that, some evidence can help the patient through with some treatment. We got whole team, to help you with this one, regardless the outcome, but we try our best. So that's some hopeful tone, that something, we can do, even though we know the condition is so severe, but we give them some hope, not a false one, but something to live on, and that. And at the end, to summarize and have to provide all the referral follow-up, I will, this one, he invite the patient to say, I got your cell phone number, I will talk to you, and, anything updating. Or maybe you give the phone number of the unit, and if anything you're concerned, you call directly the unit and talk to me, and I can talk to you. If you need some other help for your daughter, can refer you to, the other social worker, other people to help you. Some sort of need to follow up, give them some plan that what they fallback team if some need. So I think that's the best way to express, and the patient express a feeling. Sometimes something really quite nice, but some patient could be aggressive. But in a way how we deal every day, give emotion and empathy. Empathy is the one you need to do it. You show your emotion. You need to do it, every day. Sometimes I've seen a lot because in Vietnam, so you see so many patients, sometimes difficult, but if you practice this way, your patient will love you forever. I'm not boasting myself, but or you talk with students, I walk on the street, they know me well because I do. I'm one of them. I share I can never put my level higher to their level. I just one of them. I walk on the street bare feet. I can walk with my thumb. I can relate to the patient well because I have my empathy to them. So this way you practice it every day. Your job will be easy. Then no one, patient can allow to beat you because you're so good at that. You allow patient cannot abuse you because you do well. You excel in your job. It's a little bit more. It's hard, but I think you're on the way there. Congratulations. This is a very dry topic, but we tackle this one. I think we're gonna be long. We spread the news out, spread the technique out, and it will be no longer we'll see on the news that doctor being bashed up by your patient.
Thank you very much for your kind words, and Ho. I just want to, and Ho mentioned, this is not perfect. I like to show you guys this is how real life situation is and how we can make some difference. Okay, Dr. Do, Queen, any comments?
I think I agree with what you guys said. One thing that but for me, when there's some patient asks about am I gonna die, like instead of saying yes or no, because if you say no, you might be lying. If you say yes, you might worry them. So I usually just say something like this: it's very difficult to tell now, but I want you to know that your family member or your husband, your wife is in a very critical condition, to let them know that, okay, they're sick, but I don't want to tell them that they die or they not die. And then, but then the next thing they want is like, we have other, option. We have a whole team where we do our best to support or help them. So like they feel that, you're on the same team with them, but never tell them yes or no when they ask die. And I never answer that directly because it's a lose-lose situation. You're not going to win either way.
All right. Any question from you guys from the class, how we do, and the feedback from Dr. Ho and Dr. Do? Questions? Yes, go ahead.
Các bạn nào muốn thực tập?
Thank you so much.
Đói bụng rồi, đừng chấp đi ăn.
Ở đây không được ăn mà sau buổi mình thực hành cái này á, thì nghĩa là có bạn nào muốn diễn lại để coi thử là mình đã lãnh hội được cái gì và mình có thấy cái các bạn nào muốn không?
Alright, so here's
I volunteer to be a patient. Quick, you know. Okay.
the whole could be a quick patient.
Mình chia sẻ như này, tại vì ở đây á, thực ra là các bạn rất là trẻ và các bạn rất là mới, thì khi mà đưa những cái bad news như thế này á, thì khi mà mình làm lâm sàng á, thì thường á, là những cái người mà có kinh nghiệm á, là sẽ được cử để thay mặt cái nhóm điều trị để giải thích với bệnh nhân. Tuy nhiên á, là đôi lúc á, là những cái bạn trẻ là những cái bạn trực tiếp điều trị từ ban đầu đối với bệnh nhân, thì thường á, là những cái người mà lớn hơn, những cái người mà hướng dẫn á, sẽ ngồi bên cạnh cho cái bạn trẻ đó giải thích với bệnh nhân. Vì khi á, bệnh nhân người ta đưa ra những câu hỏi á, có những lúc á, bạn trẻ là bạn đủ kiến thức để bạn trả lời được, nhưng mà cái người hướng dẫn sẽ có đôi lúc phải nhảy vào để hỗ trợ, để tránh cái sự mất lòng tin từ phía bệnh nhân đó. Rồi dần dần các bạn trẻ mới mạnh dạn hơn trong cái việc mà giải thích những cái vấn đề tế nhị, những cái vấn đề khó khăn, những cái bad news với bệnh nhân. Thì thường là trên thực tế thì mình sẽ làm như vậy.
Okay. All right. So I guess we finished, right? We don't have any more patients, doctors.
Any more questions? Yes, I will do a presentation.
Okay. So you and Dr. Ho.
Why? And my topic, and I choose the patient is Dr. Phú.
Oh no, bệnh nhân xuất viện rồi. Sợ phải chạy mẹ rồi.
Okay.
So I'll give you a simple case. Repeat the case again. You know, like your son has been admitted to ICU with your severe condition with septic shock. Now you're the patient. Are you the doctor? I'm the father of the son.
Sorry, the topic is mine, not the topic is yours.
What? What topic? What? Are you want to repeat the case again? What?
No. I just gave the topic for myself. The condition is the patient with the 5 years old girl with acute progressive, rapidly progressive glomerulonephritis. And we just treated her for 3 days, and now she get in the kidney failure, and that and you are the doctor of the patient, the dad of the patient.
Okay, I'm a father of the patient.
Yes, right. With
So you talk about a case of 5-year-olds had been admitted to hospital with glomerulonephritis and end up with a renal failure.
The rapidly.
Okay. Quick, yeah, acute renal failure. Yeah, right. Okay.
And now after 3 days treated, she suffer from the kidney failure.
All right, so acute kidney failure. So I'm the father, or I'm the patient.
You are father.
Okay, right. You're the doctors. Okay, all right. Okay.
And about your daughter condition and need dilated.
Okay, all right. Okay. Hi, hello, doctors. I just received a phone call that I heard that my daughter in very, very, very bad condition. So what happened, doctor?
Hello, Mr. Phú. My name is Thuy. I'm a doctor for your baby 3 days. But unfortunately, until now, her condition may be a more severe case. So that's the way I call you here. And could you please tell me what about you understand about her daughter, about your daughter condition now?
I'm not sure. I know my daughter has been in hospital for a few days, And I received a phone call this morning to say that my daughter was really, really terrible and the kidney about to shut down. I just rushed in the hospital. I'm not sure. Can you tell me more, doctor?
Yes, 3 days ago, you said your daughter came here with because she had edema in her face and she cannot make a quarter. So that's the way we did some test for her, and we explained for you that her disease is quite quite complex, and we try our best to get some medicine for her condition, but unfortunately her her condition is not better until now. So, and now in this early morning we take her blood, and there is some toxic material in her blood, decrease a lot, and that's why now we have to give her dialysis.
Okay, but that's still, dialysis is still okay for my daughter. She's so young to get dialysis.
Because until now something wrong with her kidneys, and that's why we have to do the filter instead of her body. So if we cannot do it, maybe many toxic in her blood continue decrease, and it maybe damage other organs.
Yeah, I know that you are a doctor. You know best. You could do what best for my daughter. But is she able to pull through? Can she survive?
I think in this situation, I cannot talk more further, but until now, it seems quite severe for her. And the first thing we will do the dialysis for her for some days, and after that, we will check again.
Please don't tell her mother. Her mother very worried about her condition. She had depression. She wouldn't be able to cope with the news. Would you please tell her?
Yeah, we are willing to do that, and if whenever she come here, and we will discuss directly with her in person.
Okay, so you sure that my daughter had the condition? You sure?
Yes, because on of the test we did for her show that the toxic material in her blood decrease step by step. So that's the way the best thing here to do for her.
Yeah, but I heard the cost of dialysis is very, very expensive. I can't afford it. We just a poor worker, I'm just a working person. I can't. So in any way, can you help us?
Yeah, don't worry so much about the cost, because your daughter have a health insurance, and 90% of the cost will be paid by health insurance, and 10% left you and the other organization maybe will together to pay for.
Okay. Okay, so please let me know, update me with my daughter condition. So I'm hoping she can come through.
Do you have any question for us?
No, I don't think I put all my trust on you, doctor. So I am, I hope she can pull through.
Yeah, thank you. I believe you can keep your healthy, but please take care for her mother. And whenever you need any information about me, I will to do that.
Okay, thank you, doctor. Thank you.
You're welcome.
Okay.
All right. Thank you very much, Dr. Hall. Why don't you give some feedback too?
Okay. When you talk first.
Okay. I like the way that you discuss with the parents, and you give him time to think about it and then follow with question. And you, I mean, used to use some medical jargon, but it's better. We don't just use simple term. So I like it. And one thing I like to comment on Dr. Thuy for Foreman is if you see she confident to speak loud. There's something I like the class. You try to practice. Many of you come up here and speak like, no, don't do that. Try to speak loud, because the moment you speak loud, say that you're confident. And in this situation, we like to see a confident doctor. And that's number one. And number two is you see that she give the father and invite, see and ask him. So those are the things that I like you to keep in mind. Okay, go ahead, Dr. Ho.
I think she scream at home all the time, so that's normal for her. So she talk loud, that's normal. There's nothing wrong. Just kidding. I think that's a way how you that we have to practice this way again and again. We get better, and the topic, look like seem like she had prepared. She well prepared the topic, and come to talk to the patient and use let jargon term and let get confused, make a patient confused, and the patient asking question and become nervous. You can't answer the question. So I think it's short, nice, precisely, inviting, all that information and summary. At the end, probably you get a bit more information. You have to summarize the case again. Mr. Ho, your daughter, I'd just like to summarize your situation at the moment. Your daughter has been admitted to intensive care with the kidney failure. So we need, unfortunately, we have to give her kidney dialysis to help her kidney to clear out the toxics. And it's very serious condition. We're working really, really hard on this, and we try to, to help her to pull through. But if any information you need to know, I give you, if you want, I can give some information on the internet. You can read about this. I can give you information. If you want, I can get some other help from hospital to help you. And I like to probably this number, you need to call the hospital if you need it. I like you to perhaps, if tomorrow I'm here, you can come here, ask for me, we can talk more. So there's a summary and a follow-up to keep them there's something ongoing, care for this patient. Summary, give again to emphasize the problem and provide some, backup for them to go through.
All right, thank you, Dr. Ho. So the rest of the section today, let's talk about the last 5 weeks, because you guys have 5 more weeks, right? And what are the things that we like to discuss in the 5 weeks? So we went over the HPI, history and physical, no, actually HPI, history of present illness. We talk about occurred. We spend quite a bit about talk about skin dermatology. We also talk about last 2 sections about how to deliver bad news. What would you like to know, or what would you like to learn in next 5 weeks?
Tuần tới mọi người muốn gì?
Tuần tới
hôm trước thì tuần tới đã. Nó thì có điều trị và cái sai khác của cái thuốc điều trị nó thì cho người nhà chấp nhận cái quá trình điều trị đó. Như vậy thì như vậy là sẽ nói về điều trị thì trong đó là nó có là kế hoạch điều trị và sự tuân thủ của người nhà, rồi những cái hiệu quả và hậu quả tiên lượng của cái phần điều trị đó. Thì cái phần điều trị này thì mỗi bạn sẽ chọn một cái bệnh riêng mình, đúng không? Ha?
Okay, so Dr. T, may I suggest that you at least try to speak English to the entire class, because I understand that you guys want Vietnamese. One thing I'd like to tell you about this.
Yes, we will discuss about the treatment period. It's from to introduce with the patient about the treatment period, the duration, the medication, and how long, and
and the side effect and the result, something around the treatment.
Okay.
For the disease, everyone can choose from the real patient.
Why don't you pick a condition and we will discuss about treatment plan next week? Okay. But I still want to challenge you to come with a random case. So for the last 3 weeks, what I like to do is I like to challenge you to come up here and we give you a case, because it's easier for you to pick a case and follow that. If you follow the old code, if you follow spike, if you follow some format, what I like you to do after today or after this class, you are able to talk to any patient in any condition, in any setting. Because next patient you see may not the one that you read from yesterday. And I told you, patient don't come to hospital with a medical textbook. They do not read the medical textbook. In their head, there's nothing say meningitis, acne, or something in their face, okay? There's something I like to re-emphasize again, that you should think and create a habit to talk to any patient, not just a template. But that's fine. Next week, we will talk about treatment plan and you pick one and we will do this. Okay, I think we're going to end the class soon. Any comment, Dr. Ho, before we close?
Đúa rồi, đúa bụng rồi, ăn đi.
All right. So thank you guys and see you next week. Thank you, Dr. Ho.
Hát đi, hát.